And the last thing, one of the next things or last things will be bursitis. So again, one of those things that becomes this sort of lump ball term, and most commonly people will think about it, and they think about it being their shoulder. You know, doctor, I got the bursitis. You know, so but really what a bursa is, it's really more of a pad, but it's in a lot of ways it's almost like a potential pad, because when you look at these surgically, they're in a normal situation they're very thin and wispy, and people have this idea that they're like a sack that's sort of squirting in grease. You know, it's oiling you up, but it really isn't necessarily that type of a structure. And when it really gets us into trouble is when that thing gets inflamed. And generally it's something that sits between a bony prominence and a tendon, or sometimes an area of a bony prominence in the skin. So some of the common areas, you may have had friends with a bursa on their elbow. It looks like a golf ball full of fluid. And the other common one is in the shoulder. So as far as how these things occur, so for example, in the workplace is going to be people being in awkward positions. They're overreaching. They handling things in a poor manner. You'll see them with traumatic events, overuse. Commonly you see people using incorrect form and technique, poor equipment, and people can also have medical problems such as rheumatologic problems. And lastly, sometimes, you know, it's like that bumper sticker, you know, stuff just happens. You know, it just happens. So again, that sudden pull or pop that people may feel in the muscle, swelling, cramping, bruising, and obviously pain. As far as signs and symptoms of sprains, again, pain involving the joint, swelling, a feeling of a pop or tear, bruising, loss in ability to move and use the joint. And these signs and symptoms can vary in intensity depending on the severity of the sprain. And again, lastly, instability. So the classic treatment out there is also called the RICE treatment. And most people here, I'm sure, have heard of that, which stands for rest, ice, compression, and elevation. Next, what a doctor may say. Again, treatments for sprains and strains basically are the same. You're there to try to reduce swelling and pain in the first day or so, and usually it's that RICE treatment that we talked about. So you're going to rest the area. If it's the ankle or knee, they may tell you to be on some crutches or a cane, be using some ice for 20 minutes or so, compression to try to help keep some of the swelling down. And your physician would go over what they feel may be best for you. As far as afterwards, as far as treating the pain and swelling, as far as some exercise to prevent some stiffness, again, your therapist, if it requires, can help guide you with these types of things as well. And lastly, if you have a painful sprain or strain, you'll see a doctor. This can help you get the right treatment. So the next big thing, and obviously why everybody's here, is prevention, because once it's happened, then you're stuck in the loop. So as far as some of these things, number one is proper stretching. But some of these things have changed too. It's like everything else out there now. It's like before it was like you stretched as hard as you could beforehand, and that was going to protect you. Well, that's not necessarily the case anymore. So it's like everything else. Coffee was bad for you. Now it's good for you. Eggs were the worst thing you could eat. Now they're the greatest thing you can eat. So it's like you're so bombarded with information that can be contradictory. But sort of the latest things now is just really is more of a light stretch beforehand and a good warm-up. So this aggressive stretching actually can be detrimental as far as actually your performance and also risk of injury. The other things is prevention also comes into is proper technique and proper lifting. Also the environment you're in, and just plain common sense. I mean, sometimes it's just like, gee, maybe I shouldn't do that, and it's like sometimes your instincts are good. So, and again, a lot of these things just will be intro for Rob. You always want to do a proper warm-up, a mild stretch, and as far as a bit of a warm-up, sometimes just a little bit of time as far as on a stationary bike, some jumping jacks, just some things to progressively warm up as well as a mild stretch. The other thing that you're going to hear so much about now more and more are core exercises, which are all these exercises through here. So you're going to hear over and over and over. It's going to sound like the Marines because they're going to talk about the core, the core, the core. And I'm sure a lot of people are probably hearing more and more about that. It always pays to invest in good equipment. if you're new to a task or new to a sport, take some good lessons so that you know how to do things properly. Maintain a healthy weight. 10% rule as far as how you increase your activities. The old story of try not to be a weekend warrior. You do nothing all week, and you go out and play hard on a Saturday, and I'm seeing you on a Monday. It's that continued work and continued activities so that you stay consistent. And also make sure you stay hydrated, drink your water. So as I was saying earlier, exercise. The core. There's a lot of things now being done as far as whether it be the Swiss exercise balls, Pilates, yoga. That's a picture of Dante Culpepper back a year or so ago. There he is doing yoga. So it's things that you're hearing more and more about. Good cardiovascular training and then sports-specific training. As far as stretching, again, Rob will be talking about a few of these things. So I'll let him kind of delve deeper into some of the different stretching techniques. And lastly, just as far as sense and safety, as always, listen to your body. Some things you just can't do. I remember I was going to hang with the big dogs. I was just going to curl them up, and I was going to hang like I used to. And 3 days later, the tendonitis kicked in, and it was like, this wasn't a good idea. Look around, check your equipment, make sure things are in good working order. And that's